Hello, everyone. My name is Peter Tabbins, your member of Provincial Parliament for Toronto-Danforth, and I'm delighted to be your host tonight for this virtual town hall meeting. I'm very glad you're joining us in this community conversation. We're focusing on vaccines and the vaccination rollout in the East End. Before we hear from our speakers, let me start by explaining how a telephone town hall works. Right now, residents across the riding are answering their phones and connecting to this community discussion. I'm very glad to be joined this evening by Jason Altenberg from South Riverdale Community Health Centre and Dr. Susan Hoffmann, a family physician from East End Community Health Centre. I'll introduce them in a few minutes. After that, it'll be your turn. You'll have a chance to ask your questions and raise issues that you think are critical about vaccines and the vaccination rollout. You can get in line to ask a question at any time by pressing *3 on your phone keypad. You'll then be put through to an operator who will take down your questions and put you in line. So again, when you press *3 to ask your question, you'll be routed to an operator who will ask to provide your name, community, question, and who you're directing your question toward. Please try to keep your question as brief as possible. There are a lot of people on the line. I think we've got well over 700 already, and we want to try and get as many of your questions in as we can. If you don't feel comfortable asking your question live, you can tell the operator that you'd like to have your question read out. So before we continue this evening, I'd like to read a land acknowledgement. We acknowledge we're hosted on the lands of the Mississaugas, of the Anishinaabe, the Haudenosaunee Confederacy, and the Wendat. We also recognize the enduring presence of all First Nations, Métis, and the Inuit peoples. Welcome to everyone who's joined us for this town hall on vaccines and the vaccination rollout in our community. My name is Peter Tabbins, your MPP for Toronto-Danforth, and your host this evening for a virtual telephone town hall. A virtual town hall is just like a radio talk show, except instead of tuning in your radio, you answered your phone when we called. Tonight, we're talking about vaccines and the vaccine rollout in the East End. If you have a question for either of the speakers, just press *3 on your phone now to enter the queue. Now let me introduce our guest this evening. Jason Altenberg is the CEO at South Riverdale Community Health Centre and is a member of the steering committee that leads the East Toronto Health Partners, an Ontario health team serving East Toronto. He has over 25 years of health leadership experience in both community-based primary care and the community mental health sector. Dr. Susan Hoffmann is a family physician who's been working in community health centers in Toronto for more than 20 years. For the past 11 years, she's been working at East End Community Health Centre. East End Community Health Centre works with Michael Garron Hospital and the East Toronto Health Partners. So welcome to both of you, and thank you for being here this evening.
Thank you.
Now, let's get to our first caller of the night. Can we have that message, please? Aha, a shy crowd. Well, while we're waiting for people to post their questions, Dr. Hoffmann, can you tell me a bit about your experience so far with the vaccination program in the East End?
Sure. So the first thing is thank you very much for inviting me today. I'm actually really happy to be here because I think that the more we can do to ease people's anxieties and improve confidence in getting vaccines, the better for our community. We've had a lot of clients who've been waiting for the vaccine and who are very interested to get it. We've actually had some pop-up clinics in our clinic to receive it. And the one thing I would say is that I really do feel confident with these vaccines. I would not recommend anything that I would not be prepared to do myself or my family. And I feel very privileged that I was able to get this vaccine. And I would say that people have asked me, what are the side effects I had from this vaccine? And I would say the biggest ones I had were gratitude, relief, and hope. And I want everyone in that community to be able to have that as well.
Okay, thank you. We do have our first question in. It's from Jean. And Jean, I'll let you go live. And I believe your question would be to Dr. Hoffmann.
Hello? Hello, Dr. Hoffmann?
Hello?
Go ahead, Jean.
Hello, are you there?
Yeah.
Okay. I have two questions, actually. I'm wondering if if you've had the first Pfizer shot, can you mix it with, say, the AstraZeneca for the second shot? Because my second shot is not scheduled for 91 days later, and I'm not very comfortable with the length of time between the shots.
Okay, so good questions. The one thing I would say is that for everybody, the second shot is going to be up to 4 months delay. The only people that is not going to apply to are people in long-term care or some of our Indigenous communities in the north. It's safe to wait the 4-month period because immune levels remain high. Right now, there is no mixing and matching of vaccines. So the one that you start with will be the one that you get the second dose. But there are studies ongoing to see whether it is possible to start out with one vaccine, for instance, one of the AstraZenecas, and later on receive Pfizer or Moderna. Those studies are ongoing and there's no answer yet. So I would say not to worry about the duration. And for right now, there's no mixing of vaccines, but that may change, or it might be that you'll get your first set of vaccines now, and later on, if we need a booster vaccine for the new variants, that it may be a different one.
Okay, thank you, Dr. Hoffmann. The next question I have, I'll be reading out from Craig. My husband has shingles. He's currently on antivirals to treat it. Should he avoid getting the COVID vaccine as it might interact with the antivirals? And as a clinical question, Dr. Hoffmann, I'll go to you again.
Okay, so first of all, what I would say is that you don't want to do a vaccine while you are still unwell. So I would wait until your illness has completely resolved before getting a vaccine. We want your immune system to be able to respond well to the vaccine and not be fighting something else at the same time. And sorry, what was the other part of that question?
Well, no, that should he avoid getting the COVID vaccine?
All right.
Or might it interact with the antivirals?
So there's no interaction between the vaccines and medications. So that is not a concern. It's more that you want to get over your acute illness first.
Okay. And our next question is from Ijeoma. Ijeoma, we're going to have you go live, and I think we'll have you directed towards Jason. Do you want to speak?
Yes, I have a son who lives at home with me who has multiple disabilities. He just received his vaccine today, but there's been no information about when I and my husband, who live at home with him and are his primary caregivers, are going to get our vaccines.
Thank you for that.
I'm wondering
why that is and when will you know? So this is a really good question. First of all, it's good to hear that your son has received their vaccine, but and appreciate that actually, if I was in your shoes, I would feel similarly concerned about as a caregiver when is my turn. And as you will know, in some of the rollout of vaccine to long-term care, essential caregivers were identified and vaccinated along with the person they were caring for. That is actually in wave 2. So the best answer I can give you is that is expected to happen in phase 2 of the rollout for people who are essential caregivers or family members living with people with significant disability or disease that requires them to get vaccine. And we expect that to happen starting at some point in April. I'm just pulling up the information, and I don't have more specific. Unfortunately, we don't actually have greater specificity than that. The expectation, though, is that sometime in April, somewhere between April and May, that family members and caregivers of people living with that wave 2 of people with significant illness or disability will be in that phase of the rollout. I don't have greater specificity than that at this time. I don't know, Dr. Hoffmann, if you perhaps do, but I don't think we know more than that at this point. No. And we've been following this. We have a lot of clients out of our community health centers who are in this situation. are asking very much the same question. And right now, all we've been shown is, and I can provide as a follow-up to Peter's office, the link on the Ontario website that has how they're staging that rollout. And right now we expect that sometime in April or May.
Okay, thank you very much for that. The next question will go live with Norma. Norma, you're on the line.
Okay, I'm getting vaccinated tomorrow. And what I'm wondering about is, when I get vaccinated, will it protect me from the variants of concern that's out there?
Why don't I go to you, Dr. Hoffmann, because I have a question coming up for you, Jason, after that. Dr.
Sure.
Hoffmann.
So first of all, congratulations on getting your vaccine tomorrow. That's great. You know, I don't know which vaccine it is that you're getting, but these vaccines are slightly different. They are all they're all good in terms of what we're dealing with in Ontario at the moment. So the main variant that we're worried about is the UK variant, and the Pfizer and Moderna vaccines have been, you know, they don't work perhaps quite as well as the regular COVID virus, but they still are quite good. We're not sure in terms of the Brazilian variant, but we don't seem to have a lot of that around. And AstraZeneca, which is being used a lot in the UK, has been good with the UK variant as well, which again is the main one that we're seeing. The one thing to know is that all of the companies are working on adapting their vaccines over time, so that as these new variants come about, you know, we may get booster shots eventually that deal better with variants as they come.
Okay, thank you very much. Our next question from Paul, I'll be reading it out. And this, Jason, is for you. Will the community health centers be involved in the administering of the vaccine for their regular patients or for the broader community?
So this is a really good question. We've across Toronto, in East Toronto right now, the CHCs have been able to, based on age priority and other priorities, provide vaccine in our East Toronto partnership for our existing clients of our CHCs. In addition, we've been working with Michael Garron Hospital and East Toronto Health Partners to administer vaccines in shelters, which we finished our first wave of vaccine rollout to homeless people in the shelter system in East Toronto last week. And we're planning for participating in group homes and other congregate settings as well. And that will be that's a partnership between CHCs and the East Toronto Family Practice Network and Michael Garron Hospital. Some of our broader network is also going to be adding some additional vaccine clinics, again with Michael Garron, starting this week in Thorncliffe Park. A large mass vaccine clinic will launch on Wednesday, which is a partnership between East Toronto Health Partners and the city, Toronto Public Health. Jimmy Simpson is operating right now for healthcare workers, but eventually will be open to the broader community. And the CHCs, along with other parts of primary care and the hospital, will support those initiatives in a variety of ways. Eventually, when AstraZeneca and Johnson & Johnson become available and can be managed directly in primary care without the special cold storage needed or pharmacy support needed to prepare the vaccine, we expect to see the CHCs and other parts of community primary care do significantly more vaccine clinics, both for our own clients and in partnership. So as we do with flu vaccine and things every year, for those of you in East Toronto may know that we often collaborate as CHCs to do outreach, whether that's in Toronto community housing and other places. Because of the nature of this vaccine, it's all been partnered with the hospital or hospitals because of the particularly with Pfizer and Moderna, the need for specific cold chain storage and preparation. But we do expect that we will do more as we move forward. We've actually just been planning with homeless drop-ins to do some vaccine clinics as well in partnership with the CHCs. So it will be a mix of both.
Okay, thank you, Jason. This next question is live and I think best directed to Dr. Hoffmann. I have LaSalle. LaSalle, you're on the line. LaSalle, are you still there? Well, if she's not there, what I'd like to do is ask the question because I think it's an important one. As a person of color, I'm concerned about AstraZeneca. How do we rely on the vaccines? Black people have always been skeptical about vaccinations. It's a bother. What's the trust given the controversy in Europe? Dr. Hoffmann.
Okay, so first of all, it's a very good question. And I think we all acknowledge that, that if we look in the past, different communities have reasons to not be trustful of the medical system. So whether that's the Black community or the Indigenous community and testing and studies that were done in the past, what I would say is that when they have done studies for these vaccines, all of the studies have included people of color, people of different ethnic and racial backgrounds. And so we're not using a vaccine that hasn't actually been tested. I think in terms of the AstraZeneca vaccine, perhaps I should just address that at the same time, because I think most people have the same concern, is that people have been reading in the news, the concern of blood clots in Europe and other countries having been concerned. And I think that has led to a lot of worry for people here. What I would say about that is that anytime there's an adverse effect or there's even a concern that a vaccine could be causing a problem, there are safety mechanisms in place. So if we had somebody who suffered a consequence, even if we thought it was not necessarily related, we would report that, we would fill out forms. So in Europe, when they saw 30 cases of blood clots related to the that could have been related to the AstraZeneca vaccine, they decided to investigate it. They put it on hold. Here in Canada, what they did was they said, first of all, we're using a different batch of vaccines. In Europe, after doing their investigation, they came to the conclusion that it is not related to the vaccine. And in fact, in terms of AstraZeneca, there was a new study that came out today from the United States that did their own very thorough study, and what they found was they found that the vaccine was safe and very effective. So I think we recognize how different communities may be apprehensive, but I think these are safe vaccines and have been tested also in the Black population and in a broad, diverse group of people.
Okay, Dr. Hoffmann, thank you very much for that. We have another question that I'll be reading out. It's from Lee. And Jason, this is for you. Is it true that pharmacies aren't booking second shots? Will they be expected to follow up later, or are recipients expected to find a source? Jason, if you could address that.
So I actually, it's a really interesting question, and I was not aware that second, now I do expect, I wasn't aware that bookings weren't being made available through the pharmacy, so this is something I would have to check into, to be honest. I expect that that's similar to all the vaccine rollouts. The lengthening of time between the first and the second shot may be the issue. And there should be then an outreach or follow-up to let folks know when they're due for their next vaccine. And it should be, as Dr. Hoffmann said, the second dose should be the same vaccine as the first dose, and separated by roughly between the first dose and the second dose about 4 months, unless you fall into a particular risk group that is in a shorter time frame. But if you were received AstraZeneca at a pharmacy, my understanding would be you would go back in 4 months to get that second dose, whether it's at the pharmacy or maybe in 4 months it could be at primary care. All of the first doses are being registered in a computer system called COVAX, and that system tracks when you got your first shot and then when you will need your second shot in about 4 months. So that's my understanding. In terms of who is responsible for booking that second shot? I don't know the answer to that with respect to the pharmacies. And I don't know, Dr. Hoffmann, if you know better than I do, but I'm not aware of how that happens.
Either I've heard of people who have got a booking, but I've heard of people who have not, and likewise with people who've received at the hospitals. I know myself, I've received an email that says we will get back to you in April or May to schedule your second appointment. So I think what Jason has said is correct. This is all very centralized. Everything is going into the same database so that things don't get missed. And I would also say, if you for some reason find that you are not contacted, then contact your primary care provider, and hopefully they can help you sort that out.
Okay, thank you both. I have the next live question. David, you're on the line. David? Okay. I will read out the question then, because we've had two people ask this one. I have lupus, severe delicate immune system. How will the vaccine affect me with my already compromised immune system? Dr. Hoffmann.
Okay, so that's a good question that relates to a lot of people who we would consider immunocompromised, so whose immune systems may not be as strong. So the first thing I would say is, remember that even though I'm answering these questions, when it becomes very, very specific, do consult also with your primary care provider or specialist. The idea is that being immunocompromised doesn't mean that you cannot get these vaccines. What it may mean is that a person may not mount as strong a response to the vaccine, but they have not found that the vaccine will actually affect the condition itself. So I think having a condition like lupus or rheumatoid arthritis is probably even more of a reason that you want to get vaccinated, because the question is, if you were to get COVID, the risk of getting more seriously ill could be there as well. But definitely I would say reach out to your rheumatologist. And the thing to know is that for people who have very, very detailed questions, as family doctors, we have a lot of this information, but sometimes we may not have the answer either. But we can reach out to your specialist as well. It's very easy for us to confidentially email them. I've done it with a number of my patients. I get quick responses. The specialists, the primary care providers, whether it's your doctor, your nurse practitioner, we all want to do whatever we can to get the answers so that you can be confident in getting your vaccine.
Okay, thank you very much. We now have Angela, who has a question, and I think this will be for Dr. Hoffmann. Angela, you're live.
Hi, my name is Angela, and I just found out on Wednesday that I had a minor stroke, and I'm in the early 70s. Do I need to wait until April or May, or do I have a priority to be vaccinated?
So that's a good question. First of all, I'm very sorry to hear that you had a stroke. I hope that you're okay. I'm not sure if you found out that it was a recent stroke or is one that you had in the past. Right now, people who have underlying health conditions are not eligible any sooner for the vaccine. But what I would suggest that you do is, because certainly having had a stroke, again, it's very important that you get immunized. I would ask your neurologist what the best timing is after having had the stroke in terms of getting the vaccine. But right now I would concentrate on getting well. And I would make sure also, and this applies to everybody, that despite these vaccines, that we're still continuing to follow all of the other precautions, whether it's distancing, hand washing, masking, and the time will come soon to get a vaccine.
Okay, thank you very much. The next question I have live is from Michelle, and I think it's for you, Jason. Michelle, you're on the line.
Thank you. Hi, Jason. I want to know whether or not CHC clients have to book their vaccine appointments through the website, or will the CHC, who of course know who we are, contact us when our turn comes up?
Great
and
question.
I have another question about, right after that, a question about whether or not we have a mobile team available for clients who are homebound.
Happy to answer both, Michelle. So first of all, your CHC, so if you're a CHC patient, we will contact you. Having said that, if you're in the age group that can book online and you are able to attend a mass vaccine clinic and you wish to do that, you absolutely can do that as well. So, but if you're a CHC client and you're in the age group that's coming up, we will reach out. We're making lists, and we will be proactive, and we have been able to do on-site clinics so far for our over 80 clients and some of our homeless clients, and we intend to keep doing that as things open up and as we're able to continue to vaccinate. But it may be convenient for somebody to book online in the online system and attend a mass vaccine clinic that's being operated by the city. They're absolutely able to do that as well. So one doesn't preclude the other, but we will be proactive and reach out. So both are true. In terms of mobile, so in East Toronto, we've been doing a number of mobile clinics, mobile outreach to people that are homebound, starting with about 10 to 12 seniors congregate living settings, including Toronto Community Housing, Wood Green, and other settings. And that's been happening proactively, again, as an East Toronto Health Partners OHT partnership. As well, separate to our OHT homebound outreach, the city and with EMS, the paramedics, and the group formerly known as the LHIN, Ontario Health Regional Office, that runs home care, are with UHN are launching a home visit vaccine program coming up just now. They're just launching it for people who need a home visit for vaccine, who are either receiving home care or their family physician or nurse practitioner can register them directly and they will then go out and do vaccines for homebound folks across the city. So there's two ways that we're doing outreach to people who can't get out to vaccine clinics. And then lastly, I would say the other thing we're just lifting up together with some partners, there's a program in the city called Toronto Ride, which offers low cost transportation services to seniors. We're looking to offer transportation support free of charge to vaccine sites for people who need that support. So not quite a home visit for vaccine, but a way to help people get to vaccine if they need it. So three ways that we're addressing that. One is citywide, one is East Toronto Health Partners specific. Or two, and then the ride service will also be citywide. I don't know if there's I know there's a window there for a follow-up question, and Michelle, I don't know if you're already gone, but if there's a follow-up and you have one, happy to.
Yeah, the other thing I would just add to that, in terms of the clinics we've been doing within our center, we often haven't had very much notice about it. So we may find out 3 or 4 days before the clinic, and then we have phoned all of our clients, say, who are over 80, and that would include both. We've done it with our clinical clients. We've also done it with patients who have come to our center as part of community outreach in the past and received flu shots here. So, but we're actually being very, very proactive. So I spoke to a patient probably 5 days ago who asked me if we were doing a clinic for people over 75, and I said, not that we've heard of. And 2 days later, I phoned her back and said, come on Saturday. So we are on top of that.
Okay, thanks very much. I'm going to go to the next question from Rob. It's an advocacy question. We're getting a lot of information that vaccine line is slow, but it seems it's more like the rollout that's the problem. How can the community work together to get vaccines out of fridges and into people's arms? Jason, I'm going to give that to you.
So I'm going to start by saying in East Toronto, I'm not going to speak for the whole rollout, but in East Toronto, I know because we see the information from Michael Guerin, we're emptying our fridges in East Toronto. So I know while there are some, we see in the news that there might be some hundreds or thousands of vaccines still in fridges. I know that when we get the updates from our partners at Michael Guerin, sometimes we're down to 50 vaccines left in the fridge before a new shipment comes. So I would say locally, the rollout has been really, really, really good. And I think, as we did in how we approach testing, there's been a lot of outreach, a lot of engagement, although sometimes on short notice, as Dr. Hoffmann said, lifting up local community pop-ups in primary care settings. And so locally, we've done really well. I think one of the things we can advocate for is the kind of partnership model we've enjoyed here in the East, where our acute care partners, our community primary care partners across all the different primary care models. The CHCs are always partnered like this, but I would say we've seen a really incredible engagement from all of our primary care models around partnership, long-term care, housing, et cetera. And as Dr. Jeff Powis, our ID specialist, lead one of two in East Toronto, says, we're out there hunting this down, not waiting for it to come to us. And I think that that's been our approach, that we want to make this easy for people. We don't want people to have to go out of their way. We understand all the valid reasons people might be anxious to get vaccines. We understand that making it easy helps, and that being proactive both around engagement and education, but also in making it easy to get the vaccine makes a difference. So I think we need to advocate for that type of partnership model. And I think where we see success is where those kinds of where hospitals aren't just passively waiting for people to come to them, but they're partnering really actively with community agencies, particularly agencies that address health equity issues. So if we're going to really get past the valid fears that Black and Indigenous and other people of color have about the healthcare system, the vaccines, those partnerships need to be authentic and deep. And they need to be with people that really are deeply trusted by communities. And I think that that's something so that's going to be I think those are the kinds of things we need to advocate for. And I think sometimes we think people, if people want it, they'll come. There's lots of reasons that people just don't come. And I think that that's part of why there's been problems with the rollout. I think we also, I'll be honest, this is my editorial personal opinion. I think we've politicized elements of the rollout in ways that are not healthy for communities. So there's, I think, been tensions between health units, the municipalities that run them, provincial operators, things like that, around who's doing what and who's doing it better. And the only way to do this is to do it together, and to not feel that that we want to better some other part of the system or compete. This has to be an incredibly collaborative effort. And I think politics can get in the way of that sometimes. And I think it has in some ways in the rollout. I don't like hearing anybody say, it's this person's fault that we aren't delivering. I think we just need to say, all of us need to say, how can I lend my energy and efforts to do better together? And I think when we start finger pointing and making this a political issue, we get in our own way. So we need to be focused on what we really all want and need, which is to really get this into the community and where it's most needed most quickly, and eventually make it available to absolutely everybody, so we can all get back to many of the aspects of our lives that have been sidelined by this disease.
Can I just add one thing? I think that, as primary care providers, so doctors, nurse practitioners, we really are waiting for having the vaccine in our clinics. And I think that will help a lot as well, because many times, whether it's a flu shot or any other shot, I may have somebody in my office who we discuss it, and the person may be reluctant to get a vaccine, and a short conversation and answering questions and dealing with fears, giving information, a person will say, actually, I really would like that vaccine. And the ability for us to then be able to there and then vaccinate will aid in this. So I know family doctors and nurse practitioners around the province are looking forward to the time when we will be able to do that. And I think that will help a lot as well.
Couldn't agree more. Primary care and community distribution is going to be the trick.
Thank you both. I'm going to go to John now. John, you had a question, and I think most appropriately to Dr. Hoffmann. Please, you're on the line.
Hi, thanks for holding this tonight. It's really helpful. My dear mother-in-law has got her first shot, and her other shot will be coming soon. And I'm wondering what that will mean to us and our family visiting with her, because none of us have had our shot. And then a follow-up is when we might expect the next round to go below 60 for shots.
Dr. Hoffmann, it's yours to start.
All right. Well, the first thing I would say is that's great that your mother-in-law got her vaccine. Now, the one thing I would say is remember that when you get your vaccine, it still takes time to build up immunity. And so we have to be careful that we don't assume that right away we're home free. So everybody should continue, despite the vaccines, with masking, physical distancing, hand sanitizing. Especially in the context, as you've pointed out, where your mother-in-law has had the vaccine, but the rest of the family have not yet. But the hope is that, as people get vaccinated and families are vaccinated, then we will eventually be able to, resume more normal life. But for now, I would say, great that she had the vaccine, but still keep all the other measures. And in terms of the second part of the question, I think was, when will people in their 60s get the vaccine? Well, first of all, people in their 60s can get the vaccine right now. And so the AstraZeneca vaccine is available for people, initially was people between the age of 60 and 64, but now it's people over the age of 60. So reach out to your local pharmacies, to, you can phone around, you can see who has it available, and eventually, hopefully, in our offices as well. But so it is available already for over 60.
Okay. Thank you very much. Just before I go to the next question, I want to make a reminder for those of you who've joined more recently. I'm MPP Peter Tabbins. I'm joined this evening by Jason Altenberg, who's the head of South Riverdale Community Health Center, Dr. Susan Hoffmann, who practices at East End Community Health Center. If you want to get in line to ask a question, please press *3, and one of our operators will take your call, get background information, and bring things forward. I note now we have a question from Cynthia. Will people with allergies be affected in any way? I have a terrible allergy to wheat. I'm very leery of the vaccine. I want to hear all the suggestions put forward. Dr. Hoffmann, I think that's yours.
All right, very good question, Cynthia. I think a lot of people with allergies are concerned. So the first thing to know just in general is that people with allergies, well, everybody after receiving the vaccine will be observed. And so everyone will be observed for 15 minutes to make sure whether there's an allergic reaction, because allergic reactions, especially severe ones, tend to occur very quickly. People who've had severe allergies or anaphylaxis, so the type of reaction where you have swelling of your throat, hard to breathe, people will be observed for longer, so for at least 30 minutes. The thing to know is that this vaccine has no wheat in it. It has no food. It has no live viruses. It has the other things that people are concerned about. There's no mercury. There's no thimerosal. So really, I think, and there are no antibiotics. So people who've been allergic to penicillin, to wheat, etc., it's safe to get this vaccine. The main allergy we're concerned about is something called PEG, which stands for polyethylene glycol. And that is, the people we're concerned about are people who've had the anaphylactic type reactions to PEG. Those people are usually well known to allergists. They're people who've had an anaphylactic reaction to the preparation for a colonoscopy, or taking medications like Gravol, extra strength Tylenol that have PEG as part of them. So people who have those kinds of allergies would be, doesn't mean they can't get vaccine, but they should be referred to an allergist who could recommend the safest way to receive a vaccine. And again, if people have concern about allergies, reach out to your primary care provider. There is a system that we have an ability to do what we call an e-consult, where we can consult with a team with allergists with expertise related to questions with the COVID vaccine. So don't not get your vaccine. I think in the case of a wheat allergy, you're fine. And hopefully this is a bit reassuring.
Okay, thanks very much. Our next questioner is Stephanie. And I think this is a question for you, Jason. Stephanie, you're on the line.
Hi there. Hi, everybody. You answered this to some extent before when you talked about there being some venues for seniors to get vaccinated, particularly people, over 80 who can't leave home. And you talked about this RIDE program coming up. So you partly answered my question, which was, how can we help? I understand John Tory said the other day that the vaccines, the number of vaccines for people 80 and up sort of exceeded the number of takers for the vaccine. So I just wondered in my community, like how I could help, people who perhaps needed a ride to get to the vaccine appointment in a safe manner. If there's anything set up in the community that would facilitate that more easily, so we can connect with people who might need somebody to go with them on the bus or a ride in a car that's masked and distanced, that sort of thing.
Thanks.
Yeah.
Stephanie.
So first of all, I think that I would certainly encourage you, if you have people in your neighborhood, in your community that you're connected to that are in the age demographic or demographic that can access vaccine, but you're worried they aren't accessing it for some reason. I think it's great to help identify those folks and ask if they want help and assistance. So one of the ways might be to help somebody go to one of the set up mass vaccine sites. So for us, there are going to be a few of those locations in East Toronto that will be accessible. And for some people, just an offer of support might actually be the thing that they need. In terms of the RIDE program, Toronto RIDE is the name of the system that's going to be making free rides available to people to attend vaccine clinics. And that Toronto RIDE is an existing transportation service that offers usually low cost rides for vaccine. We're looking to do it for free completely. And so if you go online and you look for Toronto RIDE, you'll find it, and it's a network of agencies. South Riverdale happens to be one of them, Wood Green, Sprint, and a number of others that have vehicles and drivers. We've put in plexiglass in our between the driver and the back seat. They're accessible vehicles, that sort of thing. So that's just something we've been planning this week, and I expect will be online as soon as next week. So if you look up Toronto RIDE online, and as soon as we have that ready to go, we'll blast it out through Peter's team and office as well, and make sure that people know about it. So that's going to be another way that we can support this. And again, our drivers have a training and they've been vaccinated. So that's the other thing. So they have a number of ways of being protected as they do this work. So that might be a very good option if you yourself are going to be transporting somebody, or, but a really important option. But I do think, I have neighbors in their mid-80s across the street. I've been checking in on them regularly to ask, did you get the call? Did you get called to get your vaccine? And earlier late last week, they were like, yep, we got called and we got our stuff. So I think that kind of neighborly approach, checking in with people, asking them if they need help, is something we all should be doing. We're going to build, I think, as the systems to make them as accessible and easy as possible. But I know that for my neighbors, it meant something that somebody was paying attention and was concerned for their well-being and was willing to make, I said, if you need me to help or make a phone call, or who's your doctor, and, making sure that they were aware that it was their turn, and that if they hadn't, for some reason, been queued up and invited in, that there are easy ways to do that for people at this point, anywhere over 60, actually, but certainly over 75 now for the provincially run clinics or the ones that we're offering and that sort of thing. So I would just encourage people to ask those questions and then reach out to any of us to find, anybody, your local primary care, your local hospital, Michael Guerin's website, that sort of thing, and find the easy, the most accessible way to get that person vaccinated. I wouldn't hesitate though.
Thank you for that. I'm going to, next question I have, I'll be reading out. It's from Chris. Are caregivers able to escort their elderly parents into the vaccination room? Jason, can you speak to that?
So in the mass vaccine clinics, I'm not sure of the answer to that. But clearly, particularly for the demographic of people that have been getting vaccine, many of them do need support to access care and services and have been able to. So I haven't witnessed it in the mass vaccine sites, certainly in our sites. People have been accompanied by their caregivers, so to receive vaccine and been welcomed in to do that. And so they've not been kept outside waiting. They've come in with their family member or whoever it is that they're accompanying, and have been able to be with them through the whole process. That's how it's worked in our sites. I imagine it's the same at the mass vaccine sites. I just haven't been there to witness it.
Okay. Thank you. And just a note to everyone, we've got about 15 minutes left, and we're going to try and get through as many questions as we can. The next is from Asma. And I'll be reading it out. And Dr. Hoffmann, I think this is one that you'll be best at addressing. Are there any updates from Europe regarding AstraZeneca causing blood clots? Are there any correlations to specific nationalities or ages, etc.? You touched on this earlier. Could you go through this, please?
Sure. So first of all, I don't think there's any information about certain nationalities. Again, what they were concerned about is approximately 30 blood clots out of more than 5 million doses of vaccine given. And of course, many more doses have been given at this point. The age range that they were concerned about are actually younger people. So people in the 20 to 50 age range, which is not an age range that we're actually giving the AstraZeneca vaccine at this point. In Canada, that may change. But there was some information. So first of all, the European investigators did not see a link between the vaccine and blood clots. There was some information over the last couple of days that the type of blood clot they're concerned about is a very rare one called the cerebral venous thrombosis, so a clot in the brain related to low platelets. And I think to be prudent, they're continuing to look into this information. So at this point, again, nothing has changed in terms of advice with giving the AstraZeneca vaccine. I would be comfortable if my family received it or my patients. The one thing to remember is people are quite focused on blood clots and AstraZeneca, but I guess two things. Number one, remember that anytime things will happen in our lives regardless. So there are people who have different medical problems, and they may have occurred 2 weeks or 3 weeks after vaccine, but that doesn't mean that it's caused by the vaccine. So so what they're trying to determine is it a causal factor or is it just something unrelated? The big thing I would point out is that if you actually get COVID, you're much more likely to develop a blood clot. COVID is what we call thromboembolic disease, so higher risk for blood clots. If you look at people with COVID, 1 in 100 people with COVID experience a blood clot. If you look at people hospitalized with COVID, they say 1 in 20 people hospitalized with COVID will have a blood clot. It may actually even be much higher than that. And so we're looking at, say, 1 in 20 or 1 in 100 compared with 30 episodes out of 5 million. So I think that's the context in which you want to listen to this information. But I do think that, things change frequently. And it's one of the reasons that we're trying to stay most up to date. And if with time the information changes and we are told no, there is a correlation or with blood clots or with any of our vaccines with any adverse effects, then we will change what's recommended and how vaccines are administered. So I think the point is that there are a lot of safety mechanisms in place.
Okay, thanks, Dr. Hoffmann. I have one now from Ron that I'm going to read out. I have a PSW come into my house daily. Why is she not vaccinated? Why does it take so long to vaccinate PSWs? They look after my wife. Jason, could you speak to that?
First of all, I would echo, it did take too long to vaccinate PSWs. I think that's true, actually. And I think that the rollout to certain parts of the healthcare workforce were less than ideal, PSWs in particular. I think we would all agree with that. I think that at this point, PSWs have been offered access to vaccine. So if they have not yet received it, it may be that they just haven't been scheduled yet. But they certainly are now eligible, certainly through all of our partnerships in East Toronto, to receive access to vaccine. People may be, I think there's a number of factors there. I don't know if this person has been offered vaccine and chosen not to, or if they've not yet been offered. If they haven't been offered, I would suggest a couple things: that they may be working for an agency that we might need to do some proactive outreach to make them aware that their staff can be receive vaccine in, for example, at Jimmy Simpson, which is set up specifically right now for healthcare workers and is being run in East Toronto. So if your loved one is receiving PSW services in East Toronto and that provider has not been offered vaccine, I would suggest that they could reach out to one of us in the East Toronto Health Partners Partnership to find out if their agency, for some reason, is not linked in to our vaccine clinics for healthcare workers. But they should be able now to book and receive vaccine. But no defending how slow that was in that first wave of rollout. I think we were all disappointed with some of the prioritization and how that happened. But that by now, that shouldn't be a barrier, though.
Jason, thank you for that. I next have Ella. Ella, you're on the line,
yes.
And it'll go to Dr. Hoffmann.
Hello?
Ella, please
Hello?
go ahead.
Hi. So
Hi.
I have a question. I am thanks for having me. I am a living liver donor. And I did that about more than 10 years ago, 2009 or so. I wonder if, and at that time, even the doctors, they were worried about blood clot on my legs. And they gave me lots of shots, lots of injections. But now I'm getting vaccine next week. I booked one, is AstraZeneca. I wonder if it's safe for me to do that.
Sure. So thanks for the question, Ella. First of all, congratulations on being a liver donor. That's a very altruistic thing to do, and it's wonderful that you did that. First of all, there should be no barrier to getting vaccinated. It sounds like you're healthy and you're well, and the fact that you had a blood clot many years ago. Again, we are not expecting these vaccines to be causing blood clots, especially. Again, I'm not sure what your age is, but you're not in the 20 to 50 age range. And even if you look at, for people who want to look further, if you look at the Thrombosis Canada website, you'll see that their recommendation is actually for people who've had blood clots that they should make sure that they're vaccinated. And likewise for people with liver diseases, the recommendation is as well. Now you don't have a liver disease, but so certainly I think you should be vaccinated. And can do so comfortably.
Okay. Thank you very much. I have a question now from Julia. Julia, you're live, and I think, Jason, you're the person who's best to respond to this. Julia, you're on the line.
Okay, thanks, Peter. Hi, Jason. So I wondered if there's been any vaccination consideration given in phase 2 for caregivers who do not live with the families that they support. My situation is I'm a sole caregiver to my 2 elderly parents who live separately in their own apartments. but they both have multiple high-risk chronic conditions, such as severe COPD, Parkinson's, asthma, and so on. And they both rely quite heavily on me for support. So I'd really like to get vaccinated as soon as I can for their sake, because if I were to develop COVID, it would have quite an impact on them.
So I would say, as you're speaking, I'm looking at the provincial guidance on who is included in phase 2, and I actually think that what you're describing is quite compelling. The provincial guidance, as it's currently written, is a bit vague. It says individuals with specific health conditions and some primary caregivers. So that that's quite vague. And I think that vagueness is both problematic, but also maybe not the worst thing, because it maybe opens up the opportunity for, as vaccine becomes more available, to actually make it available to people like yourself who are essential caregivers, even if they are not live-in essential caregivers. I will say in phase 2, the assumption is not that the primary caregivers are necessarily live-in. And it's also people who live and work in congregate settings, and some other primary caregivers are listed multiple times in the phase 2 rollout. So it's not an assumption that those primary caregivers are live-in primary caregivers. They may in fact be in situations very much like yours. So I would not say that the phase 2 guidance rules out somebody in your situation. It may be more about whether or not somebody determines that the risk factors that your parents have fall into that phase 2 category. But I think at some point it will be open enough and vaccine will be available enough that the delay in access to you should be fairly minimal, would be my guess. But I am guessing somewhat because the way that the phase 2 rollout is described is a bit vague.
Okay, Jason, thank you for that. Folks, we have about 5 minutes left. I'm going to try and squeeze in 2 more questions. Christina, you have a question, and it's for me. Christina, you're on the line.
Hi, Peter. Yes, so my question is, the Ford government has not included restaurant workers for phase 2 vaccination, despite the fact that we're one of the few industries that not only can not socially distance from coworkers or clientele, but we're also dealing with unmasked people and coming into contact with things like plates and utensils that people have used. So I'm just wondering if you can explain perhaps the rationale of the Ford government, and also what is the stance on the NDP on this issue.
Christina, thanks for that. First of all, I don't understand what the rationale is on the part of the Ford government. Since this question was raised with me on Friday, I found, as Jason said, there's some ambiguity in the way people are defined. In one list, I find that food service workers are listed, and in another, they're not. I'm trying to nail that down. I think if you're in an industry where you're exposed, where you're front line, then you should be getting protected. It simply makes sense, as opposed to someone who's working from home, doing Zoom all day. As rough as that can be, someone who's working with the public is in a more difficult position. I hope that's useful, and I'm going to go to the next question. Julia, it's live for you. Oh no, I apologize, folks. A last question from David. How quickly after the first dose does the AstraZeneca become effective? And how long after the second shot is one completely inoculated? Susan, that's yours as a wrap-up question.
Sure. So good question. Basically, after the first shot, 7 to 14 days. So probably I would say 14 days to get to build up immunity to it, and then after the second shot would be again 14 days after that shot. But hopefully, your immune levels are quite high after the first shot and are maintained until you receive your second shot.
Okay. And if we can squeeze one in. A question from Caitlin, and Caitlin, I'm going to read it out for speed. Dr. Hoffmann said one reason why Canada didn't put hold on distribution of AstraZeneca was because it was a different batch. What does that mean? How much variation can there be between batches? And you have 1 minute.
All right, well, it's good question. I think, anytime something occurs and you're noticing it with one, in one particular area, you would also want to check whether that batch has some kind of, bacteria or impurity or other reasons associated with it. And so, that was a different batch than the vaccine that we received here, but they're looking for all possible reasons why a potential adverse reaction could occur.
Okay, thank you very much. Folks, I think we're out of time with that. I want to thank Jason and Dr. Hoffmann for their time and their contributions this evening. I thought the two of you were great. And I want to thank everyone out there who joined this telephone town hall this evening. We got through a lot of information. I know that you still have some questions. Please get in touch with South Riverdale Community Health Center or East End Community Health Center. They are, as you can tell, a fount of great information. Please, of course, feel free to contact my office. But those two offices, they have the better technical background, believe me. Again, thank you everyone who made this evening possible. The team at Converso, all of my office staff, everyone who's worked so hard to make this happen. And to all of you who joined early and stuck through, thank you very much. Have a good evening, everyone.
Thank you.
Good night. Thanks for having us, Peter.
Yeah.
Good night, all.
Good night.
Good night.